Hi guys, this is Dr. Ed. I'm here with Pamala Schwartz at the Schwartz Wellness Center in Redland, California. Is that right, Redland?
Redlands, California.
Okay, that's between Palm Springs and LA. And Pamela has this phenomenal story that I think everyone should hear. And it has to do with something called ulcerative colitis. Now, usually in my patient population, I don't see it very often until the kids get older. It's one of those autoimmune diseases that attacks your colon, and it starts in that late teen years, and then you see it go on and on as a chronic autoimmune disease for most of adulthoods. And as you look at it, what I see happen to obviously the parents of my patients, or the grandparents, they're all on steroids, and the big thing is Humira, which suppresses the immune system in order for someone who has ulcerative colitis or Crohn's disease, for them not to flare up very badly. So I'm very curious. When I heard your story, Pamela, it blew my mind. So if you don't mind, because I want people to have more choices, I really want you to share. So what happened? When were you diagnosed? And what was your treatment? And then what did you do that made you this ND naturopathic doctor?
Well, I was in my early 30s, and I was living large. I mean, life was good. I was married. I had 2 children. I owned my own business, and life was very, very good. And one day, I went to the restroom, and I had a normal bowel movement, and there was a teeny weeny tiny bit of blood in that. And I thought, oh, that's not right. That's not good. I was a 100% Western med gal. So with anything that went wrong, I was immediately at the doctor's. And this was no different. The very following day, I was in front of my doctor, and we were trying to figure out what was going on. It took 1 year to get a proper diagnosis. During that year's time, I was progressively getting worse. My symptoms were getting worse. It was terrible cramping, loose stools, lots of blood, not being able to figure out what was going on. But I finally got a diagnosis a year later, and then I started traditional medication. And this is basically what I was told. You know what? There's no cure. This is an autoimmune condition. You will always have this for the rest of your life. There are thousands of people who live with this condition, and we will manage it with medication. And my response was, great, what do I take? Right? I was an excellent patient when it comes to patient compliance. I took whatever I was told to take. I grew up with allergies and asthma my entire life. And so this was no different. I was gonna deal with this like I've dealt with everything else in my life. The problem was I was not responsive to medication. It would work for a little while, and then it would stop working. So then this went on for about 6 years total, to where 6 years later, I had closed my business because I could not work anymore. In my 30s, I was on Social Security disability, which is not easy to get when you're in your 30s. I was wearing diapers because I had no control anymore. I was having 8 to 15 bowel movements a day. I was ingesting 1,000 prescription pills every 45 days. Yeah, so I was not in good shape. Part of my medical protocol, my medication, was 40 milligrams of prednisone, which I took every single day for 2 years.
That's unbelievable.
It is unbelievable.
That much steroids.
That much, I know. And I still had bleeding. It didn't stop the bleeding, it just slowed it down. So I was accepted in a double-blinded placebo study at the Mayo Clinic in Scottsdale, Arizona, where I received Remicade, which has now been approved for ulcerative colitis. And I actually received the real medication. Remicade got me off my steroids, but it didn't make me well, and it had terrible side effects. For 5 years after exiting the study, every year I would get a phone call from I had the best nurse. Her name was Danette, and every year I'd get a phone call, and the last question, to follow up, and the last question was, do you have leukemia-like symptoms, or have you ever been told that you have leukemia? No. But that was one of the major side effects. So I knew when I came back from Arizona, my doctor said, okay, look, Pam, there's only one thing left to do, and that's to remove your colon and give you a colostomy bag. The more I researched about colostomy bags, the more I realized I couldn't do that. So I began searching and began looking and felt like there's got to be more. This can't be it. But I was not familiar with natural ways of healing. I was never exposed to it. But I found a naturopath here in Redlands, and I went to her, and that's when everything began to change for me.
So how did so what did you do? I mean, at the end here now you're getting you have your traditional medicine, you're in a study in Mayo Clinic, they're doing all the things we do now.
Yep.
But I mean, I can't imagine that much steroid.
I know.
I'm sure you were cushionied and your body had changed at that time, because just by putting kids on very short amount of time, we worry about some of the side effects. I've never heard anyone being on that much for 2 years. So what did you do that was different?
So, I should say, with being on that much medication and on steroids that long, I didn't look like myself. I didn't feel like myself. I mean, I was huge. I'd always been a very slender person my whole life. And when I went to the naturopath, the first thing she did was she addressed my allergies. And she addressed the functioning of my endocrine system. So she checked my thyroid, my adrenals, and I had terrible asthma. And I didn't even really believe in what she was doing, but I really felt like I had no other alternative. I didn't want to cut out body parts. That would be the last resort. And because I'm a good patient, I did everything she told me to do, and she did. She found that there was low thyroid hormone that I had, which was not helping my condition, especially with digestion. I had very, very weak digestion. And of course, she started to address and eliminate all of my allergies. Week by week by week, I started to get better and better and better. And then there came a point to where I felt like I was ready to get off my meds. I did it very slowly and very meticulously and very carefully. I began to cut back. And I was able to successfully get off of everything, completed my allergy elimination. I became normal, what I call normal again. I was able to eat and drink whatever I wanted, but I was different in this respect that I didn't eat the junk food I used to eat before. I didn't go through and have fast food like I used to before. I didn't live a life of convenience that I did before, because I knew whatever I did before, if I continued those poor and bad habits, I could end up in the same place. So I was awoken. I began to read. I began to learn about good nutrition, and I began to learn about the differences between organic and traditional produce. And I began to incorporate some of these changes in my life. And then once I was well, I really felt convicted. I needed to go back to school. I needed to become a naturopath, and I needed to help other people who were much like me, not knowing that there are options out there, and that's what I do now. And that was 20 years ago. So
that's truly amazing. What people, there is no cure. This is a chronic disease, and essentially you're cured. So, and you did it with something called NAET. And NAET, I've seen people who had severe peanut allergies, anaphylactic. I know people who've had that, that kind of condition, and were in the emergency room a few times and were cured. Now, the hard part is really finding a great NAET provider. We'll get into that in a second, but can you maybe, just for a few minutes, explain what is NAET? And I do want everyone to Google it. N stands for
Nambudripad's allergy.
Nambudripad. That's a very difficult name.
Nambudripad, yeah. So doctor discovered it. Nambudripad's allergy elimination technique. And basically what it does is, the world, this kind of sounds new agey, but it's not. The world is filled with frequencies, vibrational frequencies. It truly is. Bioenergetic medicine is the medicine of the future. And it's where we recognize and understand that our bodies are impacted by these frequencies. All foods have frequencies. And when our body is not attracted to the frequency, it literally repulses it. That's like the scientific word we use. It's a repulsion. It rejects it. So when we eat, drink, or we're around this frequency, it causes a weakness in our body. Now for me, I had 2 weak organs, my colon and my lungs. So I grew up with asthma, and then I developed colitis. So through using a very simple, non-invasive technique, in the presence of the frequency, we tap the nervous system, and this indirectly releases endorphins in the brain, and the body says, hey, this frequency really isn't bad because I'm creating endorphins. I think this frequency is beneficial, and it makes a new association, and what a person could not eat before or be around before, they can now eat. Now that's super simplified. It's not like a one and done treatment, but if you go through the process and you have a skilled practitioner who is properly administering the technique, the results are amazing.
Yeah. So again, it doesn't make a lot of sense.
Right.
There is no cure for severe peanut allergies, and I've seen that be cured. And there's no cure for ulcerative colitis. Now, and of course, Pamela didn't even believe that this works. I mean, she says, I don't want my colon taken out. So that's how you decided to do it again, which means that you had some faith or you were desperate, one of the two. You know,
I had both.
Yeah.
I was both.
And with alternative medicine, a lot of people say, show me a double-blind placebo study. Well, you know, it doesn't really work like that. It hasn't. There's a lot of things. Even when we give medications to children, many of them are off-label. And when we give things together, they've never been studied as well. So there is this feeling like, oh, everything's double-blind placebo. Oh, we have all this answer. We really don't. And you're a miracle, essentially. I mean, and people don't know this. This is why I really wanted to capture this. And it wasn't just that you had faith in this. You changed your lifestyle. There's no, you know, a pill for an ill approach. You didn't just say, okay, fine, I'm going to go eat, you know, McDonald's and, you know, put garbage in my mouth. You really change your lifestyle. So I really want to emphasize that for everyone who's watching, that you do need, if you want to survive anything, whether it's the virus that's going around right now, that's, you know, has a massive impact in our society, or any other illness or even chronic disease, you do have to make that lifestyle change.
Absolutely. Our bodies were created to function in a certain way. What that means is we have a designer who designed this body and said, now this body will thrive if they sleep like this. Yeah. This body will thrive if it's hydrated like this. This body will thrive if it's given good nutrients. And when we defy those things, or any one of the things that we are supposed to be doing to feed our body, we're allowing parts of it, I say, to die, parts of it to not function anymore. And then eventually when you do that long term, you get a disease or a disorder of some kind. And I stopped that cycle because I was never educated that, you know, Michelini's frozen dinners really were not good for me because of many reasons. Number one, they're full of chemicals, full of preservatives, have every nutrient's been cooked out of it, and it's a food of convenience. It's not a food of health. And I began juicing. I began buying fresh produce. I began buying the best of every kind of food I could find. And I had to justify that to myself because one of the biggest objections I hear is a cost factor that's involved with that. But there is no cost. There is no dollar figure we can put on our good health. Without our health, we have nothing. And I appreciate the fact that you say I'm a miracle, and I really am, because had I not made some of those changes, Dr. Ed, I wouldn't be here. I wouldn't be here, and I know it.
And you know, lucky that your, you know, beautiful kids can watch you, and your soon-to-be grandkids. Put that energy out there.
Yeah.
You know, it is truly amazing. I think, you know, I would love to put your information out there so people can really understand that, and you're available to help people with this, right? Because your story is so powerful.
Yeah,
it's so beautiful. I love miracles. I love being around miracle people. Gives me energy, right? And it shows you all this stuff that you don't see, and you know, and your story, you know, I really want your story to get out there so people understand when a doctor tells you that there's no cure, don't listen. See, I'll take the diagnosis, but not the prognosis. Yeah. I want the diagnosis, but not the prognosis. And one of my favorite, what do you call it? One of documentaries. I love the movie Heal. I recommend everyone watch it, and that comes in there. with all these incurable things that don't make sense. The energy medicine that you're sort of talking about, you know, where electrons and protons and all of that is spinning with distance, and that's what we've been. Yes, that's what we're made of. So we don't understand that so much in Western medicine.
No.
So that's why I love Eastern or complementary medicine or alternative medicine. In addition to, there's times I'm going to talk to you a little about a different kind of condition, which is, how to help wounds. I know you have a great story about that. So watch this, as your part one, and then I want to talk about infection and immune system with Pamala next.